Dr. Barnea described dementia. I won't go into this, but I agree it's an umbrella term. It just refers to thinking changes or cognitive changes that are greater than what you would expect for age alone. And the degree of impairment interferes with one's ability to do the bills, drive, handle social responsibilities like being able to figure out the tip, that type of thing, interfering with activities of daily living. And that has to be present in order for a diagnosis of any kind of dementia to take place. The most important thing, I think, for caregivers to do truly is to educate themselves, and I really commend all of you for taking the time out of your day to come here. This is really impressive, and not only that, but to sit here for more than an hour to listen to us. And there's been studies that show that if caregivers are educated about the disease, if they learn about what to expect and how maybe to cope with some issues, there's a reduction in caregiver burnout. There is an improvement in caregiver health. And not only that, when they looked at the patients themselves, the patient's mood improved. So educating the caregiver actually had an impact on the patient. And that, to me, is just very, very important. I won't necessarily go through all of the symptoms of Lewy body dementia because Dr. Barnea did such a thorough job, but I will say that from a cognitive standpoint, from a thinking standpoint, there are differences between Lewy body dementia and Alzheimer's disease. And one of those differences is memory. The hallmark of Alzheimer's disease is early forgetfulness. What did you say? Where are we going? Just repeating the same thing over and over. For the most part, Lewy body patients don't necessarily have impaired memory. In fact, the memory region that he was talking about in the temporal lobe, that region is often spared. It often looks pretty darn good. But in Alzheimer's disease, it's very shrunken because the cells in that region are not there anymore. And in Lewy body dementia, what you see actually are early problems with attention. So what do I mean? Losing train of thought, not being able to concentrate, easily distracted, whereas Alzheimer's disease really do fine with attention. That's actually one of their strengths. Now, you can, in a Lewy body patient, see memory problems, but it may be more of an attention problem. They didn't hear you in the first place, didn't register it, so it didn't get in, so I'm not going to remember it because I didn't register it in the first place. But generally speaking, we don't tend to see forgetfulness as an early sign of Lewy body, but we do see attention problems. And the other feature, and this is why neuropsych testing, not to plug what I do, but this is why neuropsych testing can be very helpful in identifying, trying to differentiate and identify what the disease itself is. We look for problems with attention. We also look for visual problems. And that's another early sign of Lewy body dementia that we don't see in Alzheimer's. Now, I don't mean, he needs glasses, because a lot of times my patients will come, we just had his eyes checked. It's 2020. Why can't he do this? Why can't he do that? He says he can't see, but the eye doctor says he's fine. And that's very, very important to get your eyes checked or their eyes checked, because that tells us it's not an eye problem. It's probably what's being processed in the brain. And that's where the Lewy bodies are probably attacking that part of the brain. Now, other abilities, and I won't, as I said, go over in detail, just a quick Parkinsonism, fluctuating abilities where the person is lucid and alert and then incoherent and not alert, visual hallucinations, beliefs that are untrue, sometimes relating to the hallucinations, like, there's a stranger in the house. Well, he has a hallucination that there's a stranger, so has a belief there's a stranger in the house, that kind of thing. Also, as Dr. Barnea stated, you can have times when maybe the patient doesn't recognize you, and that can happen. Drowsiness is a very common feature. We're pushing to actually put it into the criteria. We didn't quite make it this time around. Dream enactment behavior, I have a video of, I'll show you. And these two symptoms are autonomic features. Very early incontinence, very early lightheadedness, where the patient feels woozy or falls because their blood pressure gets really low when they stand up quickly. Those are features that are called autonomic symptoms, and we see that often in Lewy body patients. We see it in other conditions too, so it's not that specific. And you'll see in your diagnostic criteria that autonomic dysfunctions in there, but it's not one of the core features, and it's not one of the suggested features. It's just something that you can say. Whenever caregivers come to see me, they've been to the doctor says, take this drug, take that drug, you do what the doctor says, but then the caregiver says, but what can I do? What should I do? What do I do when he's seeing something and it's obviously not there? And I think the important thing that caregivers should really take to heart is, here's what you can do. You can look for signs of excess disability. And what I mean by that is problems that are in excess, in other words, deficits that are greater than you would expect from the disease alone. So we have a sense of what the disease causes. What could be making it worse? Are there things that could be making it worse? And there are 4 areas that I will touch on that are common sources of excess disability. And under there I put mnemonic, just sort of a trick to try to keep it in your memory. PET-C, physical, environment, task demands, and communication style.